Next is cardiac rate or apical pulse. Procedure. Explain the procedure to the patient or significant others. Elicits cooperation from the mom. Today I will getting your cardiac pulse or apical pulse. Assist the client on supine position. Then cleanse the earpiece and diaphragm of stethoscope using alcohol swab. Alcohol not allows access. It allows access to patient. Swabbing action removes dirt. ROH evaporately fast and render the parts dry easily. Raise the gown and properly drape the clients, exposing the sternum and the left side of chest. Allows access the patient chest for proper placement of stethoscope. Warm the diaphragm of the stethoscope with your hand before applying it to the patient chest. Placing a cold diaphragm against the skin may startle the patient of the momentarily increase the heart rate. Place the diaphragm of the stethoscope over the apex of the heart located at the fifth intercostal space, left midvicular line, fifth ICS. Then insert the earpiece in your ears. So sir, I will not using the other side because it is na wala yung yung isa. So I'll be using the other one lang po. The this gives the loudest and most distinctive sound of the heart. Move the diaphragm to the side of the loudest beats. Count the beats for 60 seconds and note the rhythm and volume. Also evaluate the intensity loudness of the heart sound. A full minute count is important for the accurate assessment. A longer duration helps determine pulse rhythm and quality. And no distance is the radial pulse count greater than the apical pulse count. Record the pulse rate on the jot-down notebook. Refer anything unusual. Document the data. Next is blood pressure. These are the following equipment: stethoscope, spigometer with appropriate size of cuff, jot down notebook and pen, alcohol swab. Procedure. Explain the procedure to the patient. Make sure that the client has not smoked cigarette or ingested beverages that contains caffeine with 30 minutes. Ma'am, today I will be getting your blood pressure. Wala mo tanan ni garilyo or nag-inom og caffeine earlier na. Nicotine causes vasoconstriction in peripheral and coronary blood vessel, which may cause increases in blood pressure. Caffeine is stimulant that increases blood pressure. Next is place the patient in the comfortable position with the forearm supported and the palm upward. This position exposes the brachial artery so that the stethoscope can rest on it conveniently on the antecubital area. Sorry. Position yourself so that the configuration of the apparatus can Be read at eye level and no one more than 3 feet away. An accurate reading is obtained when the manometer column is in direct vision. Place the cuff so that the inflatable bag is centered and lies midway over the anterior surface of the brachial artery. The surface of the brachial artery should be at the center at the two tubings of the cuff so that the lower edge of the cuff is 2.5 to 5 centimeter above antecubital fossa. Pressure applied directly to the artery will yield most accurate readings. Wrap the cuff smoothly and enoughly around the arm with the end of the cuff secure. A twisted cuff and dropping could produce inaccurate reading. Use the fingertips of the to feel a strong pulsation in the antecubital space. Accurate blood pressure reading is possibly when the stethoscope is directly over the artery. Next back. Inflate the cuff where the pulsation disappears. Place the diaphragm of the stethoscope directly over the pulse. This will prevent you from missing the first stop second as a result to the sculptatory gap period where no sound is heard. Gradually deflate cuff of all the way to zero, taking note of the first and the last clear sound. First sound is the systolic BP and last sound is the diastolic BP. Remove the cuff and make patient comfortable. Sorry. Record the reading on the jot down notebook. Report anything unusual and then document the data. And that's all the vital sign. Thank you.